One of the first executive orders signed by US President Donald Trump has been the complete withdrawal, will call for the complete withdrawal of the United States from the World Health Organization. It's a process he began in 2020 during his first term as US president. Donald Trump says that the US is paying too much money to the organization compared to other countries. He says something in the region of 500 million US dollars. He compares that to China, in which he claims only pays 35 million US dollars to the World Health Organization. But what impact will this have on global health? Professor Salim Abdool Karim was head of South Africa's COVID-19 response. Good morning, Professor. Really appreciate your time. The United States withdrawing from the World Health Organization, not only in operational support, but also financial support, 500 million US dollars. Donald Trump says his country will save, but what impact does this have on global health and public health awareness? Professor, good morning.
Good morning, Lester, and good morning to all of the listeners. I think that the U.S. government has created a narrative that doesn't really hold up when one scrutinizes it. And that narrative is that the WHO, the World Health Organization, is biased towards China and is not supportive enough of the U.S. And that stems from his first term during the COVID-19 pandemic. And that simply is not true. The WHO has to work with all countries, and it does so. It has no special relationship with China. China doesn't have any greater involvement in the say of the World Health Organization than the U.S. The U.S., and the second narrative is created, is that the U.S. is disproportionately contributing. Well, the U.S. is a country with the largest per capita GDP in the world, but it contributes, less than a fifth of the entire WHO budget. And that really is a disproportionate in the opposite direction. So the argument that the World Health Organization is getting a disproportionately large amount of money from the U.S. is simply not true.
Less than a fifth is still 20% or below of the World Health Organization's budget. Operationally, how does this then impact on public health messaging and research, awareness, but also activities? When this withdrawal happens, Donald Trump says by the end of this year, it will stop its contribution of 500 million US dollars.
So there are several important things that the World Health Organization does. For example, if a person has tuberculosis anywhere in the world, that person needs to be treated based on the best evidence that's available. And that evidence is collated by the World Health Organization, and they bring the world's experts together and they release guidelines. And they do so for all different kinds of conditions. And those guidelines are used by almost all countries around the world as a standard for what the evidence is saying. So South Africa, for example, bases its guidelines often on the World Health Organization guidelines. So the World Health Organization plays a very important role in the way patients are being treated around the whole world. They also do other things. They, as you know, in COVID-19, they were directly involved in the response. Right now, when the ceasefire occurred in Palestine, in Gaza on Sunday, one of the first organizations to go in was the World Health Organization to provide medical support and assistance and help in the hospitals. So there are many important things that the World Health Organization does. Some of that is now going to be compromised because of its constrained budget. But I'm optimistic that other countries will come to the fore, philanthropy and donors will come to the fore to make up some of that shortfall. But one mustn't underestimate the opposite effect, and that is that by the U.S. government saying that it is now withdrawing from the WHO, that takes a bit of time to actually enact, it now is is the U.S. telling the world that actually we no longer want to play a leadership role in global health. We are now going to focus only on U.S. health, and the rest of the world can look after itself. And that means that the U.S. now will have much less leverage and involvement in global health. And that'll allow other countries now will have to step in and provide their expertise and support to make up for that.
And that flies in the face of what we should have learned over the last 4 or 5 years, the interconnectedness on public health globally, of how someone falling ill in one part of the world because of a globalized, interconnected world could have an impact on someone living in Cape Town, South Africa, could then have an impact on someone living in Sao Paulo in Brazil, could then have an impact on someone living in Munich, Germany.
I think this whole thing that's going on now across the world in many countries, including Holland, Germany, France, where groups, the political flavor of the day is one of very strong nationalism, very strong anti-immigration, very strong, we only want to care about us and we don't want to have anything to do with the rest of the world. That's their problems. I think all of that fails to understand a fundamental reality in health, and that is that we are all interconnected. And South Africa actually showed that to the world very clearly in Omicron. When South African scientists discovered the Omicron variant in COVID and announced it to the world, within a matter of a week, it was already in 16 countries. Within the month, it had spread to almost every country around the world. So you're looking at, there is no way in which a highly infectious agent is going to respect borders and is going to say to the U.S., actually, no, it's okay, we're not coming to the U.S., we're going to go to the rest of the world. That's simply not going to happen. In fact, right now, as I speak to you, the World Health Organization is preparing for the next epidemic and pandemic threat. And one of our biggest concerns is, of course, the challenge we have in the U.S. That one of the big concerns is the avian flu, the bird flu that is spreading amongst cows in the U.S. and has already infected humans. So the U.S., in a way, is part of our connected world. And if we're going to see an outbreak of that kind of flu from the U.S., it's going to demonstrate to the world the importance of everybody working together.
Let's talk about that political flavor, this regressive, reactionary right-wing posturing. One of the final acts of Joe Biden's presidency was a preemptive pardon on your colleague in the United States, I know is also a friend of yours, Dr. Anthony Fauci, who was the head of the U.S. COVID response. Joe Biden preemptively pardoning him, reiterating this does not mean any evidence or any suggestion of any wrongdoing, but to try and insulate Anthony Fauci which from possible investigation or possible harassment of a Donald Trump presidency. Donald Trump has friends and allies and supporters who have not been kind to Anthony Fauci. Apparently he walks around with 6 bodyguards after a COVID-19. What does that tell you about what was and is a positive response from public health awareness workers and the response, the right-wing response to that period of our history where some people said they've had vaccines foisted upon them, where some people even criticize even the existence of a COVID-19 pandemic. Doctor?
Yeah, I think we saw around the world how politicians and scientists had to work together to address the COVID-19 pandemic. You saw that in our own country. We saw that in the UK. And we saw that in many countries. In the US, that relationship became very complicated because politicians wanted to do X and scientists were saying do Y. One clear example of that was when scientists were encouraging mask wearing. The president at the time, President Trump, did not support mask wearing. So you have a conflict in that situation. Now, these kinds of conflicts occur in many settings, so it's not unusual. I think what's sad is that in this particular instance, these conflicts that occurred between the chief advisor, Dr. Fauci, and President Trump has turned into a grudge. And Dr. Fauci and President Trump has already stated this, that he is going to seek retribution against all those who have challenged him and didn't support him in his first term and during the intervening years. And this is not only Dr. Fauci, it applies to prosecutors who have been investigating his sexual misconduct. There's been a whole range of people. And he has said publicly that he is going to seek retribution against these individuals. So that is really, to me, unconscionable. It is sad that politicians will use their power or threaten to use their power in this kind of way. So much so that, a scientist has to get a pardon. I mean, that's just unheard of. And I have to say that it to me, it represents a new low in the relationship between science and government.
Professor Salim, Abdool, Karim, really appreciate your time there.